Whakalopalahi atu. Special welcome here. We have a really important guest with us this morning, Dr. Colin Tukuitonga, my colleague at the University of Auckland. Everyone knows Dr. Colin, previously the head of the Secretariat for the Pacific community, and of course he has that special sort of CV where he has a degree both from, I think, Harvard and also from Fiji. And so we've got you here this morning really to talk about that thing that's on everyone's mind here and to make sure we have high quality information out there. So we're coming straight to a trained medical professional, a trained public health professional, and someone who understands and leads in the Pacific community. So around the new COVID-19, what is the most important thing that our Pacifica communities need to know?
Oh, talaflava, Damon, and thanks for the opportunity. The most important thing that people can do is to learn how to protect themselves and their families. And the fundamental thing there is to wash your hands frequently with soap. That's preferred, and or sanitizers if you don't have access to soap and water.
And I guess lots of people are wondering if this is if this is an overreaction, and then there's others wondering if this is an underreaction. So I guess people are thinking every year we have the flu come to New Zealand. It is quite prevalent in our communities, but how is COVID-19 different from the kind of annual cycle of the flu?
Well, people seem to think that the coronavirus is something we should not expect, and it's come out of the blue. Well, yes, it has, but you see, the coronavirus is a evolution of the events that we see every year. Viruses continue to mutate and change. It just so happens that this particular one has been able to find what we call hosts that allow them to multiply quickly and infect other people. I mean, that's the whole modus operandi, if you like, of the virus. It finds new hosts so that it can continue to multiply. So it's not something that we shouldn't have expected. It's just that it's behaved in this way, say, as compared to the flu that we get every year. Note, the flu that we get every year, it changes, and that's why they keep changing the vaccine in order to respond to it.
So what we call the flu is not really one disease, is that one virus?
No, it changes.
Yeah. And so this is a new virus. Just so
in that mold, we've seen the coronavirus, as I say, it just happens to have behaved differently, and we're less able to respond to it because we don't fully understand the natural history, as I keep saying. What's it going to do over the long term? All of those sort of basic questions about any disease, really.
So I guess for many Pacifica families and communities, this really hit home with the cancellation of both Pacifica and Polyfest, which happened in consecutive weekends. Why do we need to cancel events like these big, these celebrations of who we are and our cultures and what's beautiful about us?
Well, it's always a fine balance, isn't it? I mean, we get together, we celebrate, we live in big groups, we have big extended families, and it's all wonderful. But when a threat like this comes along, those very characteristics that define us as a people can be a risk, meaning it's easy to transmit the virus between people who are in a big group. So the very things that define us does put us in a slightly more elevated risk.
Who amongst our families and communities, who is most at risk for not just acquiring the virus, but actually suffering from it and perhaps being in danger for their lives?
Generally speaking, I mean, we're all at risk, yeah, right? But the older you are, the more at risk you are. And also the older you are, you're more likely to die if you have the disease. Although there's some anomalies, some unusual things in Australia. They talk about women between the ages of 18 and 35 that has shown quite large numbers, and that's unusual. But generally speaking, the older you are, the higher the risk.
So apart from washing our hands, I mean, many Pacifica families live in large households. They live close together. Many of the houses don't have, often people might not have their own bedroom. They might not have more than one bathroom. How do we keep safe distances in our house while being who we are?
Well, as I say, it's a characteristic of our communities that this is the nature of who we are and how we live. And I understand totally how difficult it is if you have 2 or 3 families in a small confined space. I suppose the best advice I can give is to say, learn as much as you can about the disease. Learn what you can do within your the realities of your house, because different families will have different spaces. But the further away you are from each other, the better if you can manage it. But as I say, I understand the challenges for many families who share small spaces.
Because the government has asked people who have been overseas to self-isolate, people who are suspected to self-isolate. What does that mean, self-isolation?
Self-isolation means you put yourself away from people. You stay a metre from your closest person that's nearby. But this is my point.
That's distant.
But this is my point, where several families are in a confined house. It's very difficult, and it's a very practical problem finding alternatives. But it might be that if this is something that elevates and sustains the risk, that we might have to look at it carefully. In other words, it's easy to say self-isolate. Perhaps it might not be so easy to do where you have overcrowded housing.
Yeah, that's a tough one. So what should people do if they think they might have COVID-19 or they're feeling unwell?
If they suspect they have COVID-19, it is possible that it's the annual flu or something else. So call Healthline and get the advice if you can. I hope that Healthline has Pacific language people who can take the call. Second option is your family doctor. Ring first and say, look, I think I might have
You're showing some of the symptoms. So what are the symptoms of COVID-19? You can't tell just from the symptoms, can you? I mean, it's more complex than that.
That's right, and it's very similar to the flu. People, have sore throat, a cough, a fever. It's not characteristic, and that's why the test is important. If you think you might have COVID, then go and get yourself tested, but do contact your medical provider first, so that you're able to be managed safely and you don't infect the health workers and other people at the clinic. And that's why they say you should ring up if you can, or at least alert people that you think you might have the virus. Because
there's going to be very high demand on our health services, aren't there? So we really have to honour that phone first, use the available services before we visit emergency rooms. And
it's particularly important for us because we have a very small workforce. If they all get sick and things get worse without being dramatic, we might find ourselves in real difficulty. And also, these are people with families, so it's important to do the best they can to protect the health workers, as I say, their family, their friends, their colleagues. So do that, ring up.
So a question that lots of people are going to have is, coming into the weekend, should Pacifica people go to church?
This is a tough one. My own view is that where the church gatherings are small, then it's reasonably safe and the risks are low. This is all about risk management. You can never be certain. And I keep referring to the fact that we don't fully understand what the virus is going to do. That's why I take a conservative view. Before I became a person who speaks on radio and TV, I'm actually a trained epidemiologist. And by nature, we're trained to be, where you don't have the full information, we're trained to take what we call the precautionary principle. You end up doing more than you need because you're not sure what this is going to do. And I'm still of that view. So I would definitely avoid big gatherings, whether they're church or...
Which are now illegal, aren't they? Over 100 is illegal.
That's right.
It's really for the smaller church gatherings that it's even a question.
Yeah.
What about a question that many... I mean, we love our children. What about going to school?
Well, again, as I say, I've been on the record as saying we should think seriously about closing the schools, but I understand there are complex questions. Children who stay at home don't necessarily stay at home. They go and they may well put their grandparents at risk, or they go off and do something else. So I understand the difficulties. But children, young people, transmit the virus. That's the key thing, and often without symptoms. That's the reason why kids in school deserves attention. But as I say, there are practical limitations and considerations around that.
So we're coming into a kind of phase where there's many ways to get information out, but actually many of those channels of information are filled with bad, often malicious information. So there's now lots of stuff occurring that's posted on social media around cures for COVID-19, fake news, those kinds of things. How do we protect ourselves in terms of knowledge? What can our communities do to make sure we have a proper understanding that's scientifically based, that's contemporary, that's well informed?
My advice is to just pay attention to what's come out through official channels from the New Zealand Ministry of Health, through the Ministry of Pacific Peoples, through the DHBs. If it comes from anywhere else, I would seriously question that. The other thing to say is there's going to be lots of promises about treatments and this and that. The fact is, viruses don't respond to antibiotics or anything. And so if someone is promising you you're going to get a cure by drinking this or eating that, it's in my view is that's inevitably going to be wrong. So basic advice, just follow what you get from your from the ministry or the DHB. Just stick with that. And they're trying to translate the stuff that people need to know. I would pay attention to those. And social media is a good thing, but it's also potentially a very dangerous thing for our people.
So if someone gets COVID-19, so it's absolutely clear they won't necessarily die, many will carry it and show no symptoms, many will become symptomatic and need care, and some will not need care at all. What kind of rates of hospitalisation, serious illness and death might we expect in COVID-19?
My understanding is the great majority of people will have the virus and recover. When I say great majority, it's in excess of 80%. I also know that those who die is around 2 to 3%. And I suspect that, this might get technical, if we fully understand who's actually walking around with the virus, I think you'll find that the mortality rate is less than 3%. So when I say 3%, it's 3 out of 100 people will die from the disease, mostly old people or people like myself who has diabetes or heart disease, some other chronic condition that puts them at risk. But that's, in other words, it's a very small proportion of people will die from the disease. So let's just keep it in perspective. The great majority will have no symptoms but carry the virus, and the great majority will recover. I can't answer your question about what proportion gets admitted because I don't have.
We don't know the end, right? We don't know how many are carrying. Yeah. So, to our community leaders, what's the message? What's the leadership message? What should we be doing to care for Pacifica communities and families right now? Is there something that we should be doing to show leadership and to take that extra step to keep our people safe?
Well, I think information flow and reassuring communities. The government is doing a lot to protect, to reduce the likelihood of a community outbreak and to pay attention to those, share information about what people can do to protect their families, reassure communities there's no need to go and panic, buy up all kinds of stuff that's really not necessary at all. There's lots of material that say we have enough food. We might have a bit of a problem distributing and replenishing stock, but we have enough food. So there's no need to, because I imagine people who don't have the money would have to borrow the money to buy up large. That's really not necessary. Mm-hmm. So they would be the kinds of avoid large gatherings, follow the advice from the government. I think that those are the kinds of things I think that the leaders can help us with.
What about the markets? Do you think people should be going to the markets still? Like the Otara market, Maangere markets? We're broadcasting right here from Maangere.
Yeah, I know that the government's issued one for 100 people indoors, and that's certainly in a confined space is the risk. Look, I don't know the answer to that, but I suppose the general advice is to try to avoid big gatherings.
No. So just to come back to you to reiterate before we wrap up, the big message is wash your hands, keep a social distance. So that's hard, right? That's no kissing, that's no hugging, that's no hongi. That's going to be a tough one for our people, and we have to lead with that one. Any other really important messages you want to get across?
And just the point we made earlier about deciding what's genuine, useful information and what's misinformation. So do all of those things for you and your family within the house, but also pay attention to the information and avoid big gatherings. Avoid, promises from people who offer to sell you this, that and the other, and really try to be reassured that New Zealand has a very good health system, and everything that needs to be done is being done. So to have that reassurance, and really, as I say, the risk of people getting severely ill is quite low, but it is a new experience, and I understand why people are a little bit anxious about it.
Yeah. So spraying water doesn't work, holding your breath doesn't work. These are all things that have come up on social media. There's no pill to take right now to fix COVID-19. All of that is untrue.
Viruses are notorious for not responding to anything. And if someone promises you that food or drink or medicine or meditating upside down, all of that sort of stuff, chances are it's just false information. You're better to follow official information that you get from your doctor and your nurse and your medical centre. So
when help comes for this, because it's a virus, it will come in the form of a vaccine, won't it? And how long do you think that's going to take?
Well, that's debatable. Some people think the WHO reports that they started the trials and all going well. You can be optimistic that it'll be soon, but when I say soon, it won't be till next year, I don't think. And don't forget, there are tablets. There are antiviral tablets as an option, but again, we don't have any for this. HIV/AIDS is a virus, and we eventually, over the course of many years, found tablets that allow people to live with the virus. That's a possibility, but nothing at the moment.
Yeah. And so one more, I've had a few conversations about this, just to reassure everyone, this will pass. We have to minimise the mortality and lethality of but we're not living in the end times, are we, Dr. Colin?
This will pass. We talked about the proportions of things, and there may well be numbers of deaths that we haven't seen before, but the great majority of people, this will pass.
Yeah. Well, thank you so much for coming and on the show, broadcasting from the KBM studios in Mangere, a special edition of Pacific Critical, which is a podcast on Pacific knowledge, Pacific research, and Pacific thought leadership. And here we have a guy that combines all three. So, whawhātei lava.
Thanks very much, Damon. Thank you.